Coming out momentarily will be the President of the General Assembly. He will be joined by the co-facilitators, the permanent representatives, who he has selected to shepherd the negotiation processes on health-related issues as they concern UNGA. So it will be the President of the General Assembly who will be speaking. He will be joined by the ambassadors. So as I mentioned, the President of the General Assembly is here. He is joined by the co-facilitators, the ambassadors who he has appointed to lead on health-related issues in the upcoming high-level meetings during UNGA. The President will make brief remarks. He will then take some questions. President.
Thank you very much, Pauline. Ladies and gentlemen, thank you very much indeed for your interest, your time, and your dedication. Many, many thanks for your work supporting the activities and the transformation going on in the General Assembly. You might have heard me and others speaking in this House that it is a time of unprecedented and interlocking crisis in the world. And responding on that, it is and it must be a year of crisis management and transformation in the General Assembly. That's what we tried to achieve in the Water Conference last March. That's what we are trying to achieve during the Sendai Framework Midterm Review a couple of days from now. And that is our main focus on the HLPF in July. And that will be the main objective of all the member states on the high-level week in September in a few months' time from now. There are clear objectives in front of us. Revive sustainability transformation, its financial support, find game-changing solutions of integrated nature, seek stability for the people and planet, and advance peace and security, particularly by recommitting to the non-proliferation, nuclear non-proliferation. You may know that there are 16 negotiating processes going on in the General Assembly. It is unprecedented in our history, and 13 out of the 16 are directly related to some kind of transformation we are trying to achieve in this House and in the world. The human dimension of this transformation is very closely characterized by 3 health-related negotiating processes on the TB preparedness, the pandemic preparedness, and the universal health coverage. We are very strongly relying on the conviction of the member states and other stakeholders that when health is at risk, everything is at risk. We are deeply convinced that health is not and cannot be a luxury, but a fundamental human right. We are also deeply convinced that providing health is not a money pit, but it's an investment in sustainable development. So in September, in the second half of the high-level week, we are going to have the 3 summit meetings on pandemic preparedness, TB, fighting TB, and universal health coverage. Today, we are having multi-stakeholder hearing. Actually, it started yesterday with the tuberculosis. Today, with the lessons learned from the pandemic preparedness. And this afternoon, we are going to have the multi-stakeholder hearing on universal health coverage. Let me start with the universal health coverage. It's a kind of umbrella of health for the Agenda 2030. It's about providing good quality health services to all, each and every member of our community on this planet, without causing unbearable financial hardships. There might be different ways, different methods, how to provide it, how to achieve it in different countries. The most important that the universal health coverage should be achieved. In 2018, there has been already a joint declaration of all member states in the General Assembly that by 2030 we want to achieve the universal health coverage. We are off track. So what we need to decide in the forthcoming weeks and months, with the help of the stakeholders today, how to go back to our original goal and how to deliver for our peoples. I'm very grateful for the ambassadors of Guyana, who is standing behind me, and working together with the ambassador of Thailand for leading this negotiating process. They are doing a very good work, hard work with the membership, and they are in the process of reaching very soon a detailed negotiation on concrete outcome text. For the time being, we are gathering information from various actors, including nurses, doctors, science actors, civil society actors, companies, and non-state actors. On the tuberculosis, it's a preventable and curable disease. We even have some remarkable success. Since 2000, we could save about 72 million lives on the earth by the measures we implemented in our countries. Yet, it still remains a silent killer. Just in 2021 alone, 1.6 million people died because of tuberculosis, and 16 million fell sick with it. It is one of the leading causes of death across the world, and we know it is always linked to inequity, poverty, undernutrition, and what we need is further research for new vaccines and new drugs capable of preventing the new strains of the bacteria and curing the disease. Behind me, you can see the ambassador of Poland, His Excellency Mr. Krzysztof Czerski, and His Excellency Bakhtiyor Ibragimov, the ambassador of Uzbekistan. I'm grateful for them, for leading the negotiations of the member states, involving many other stakeholders to create a common knowledge base and start very soon the text-based negotiations among the member states. Last but not least, on the pandemic preparedness, COVID-19 revealed the nature, the very dangerous nature of a prototype of the Anthropocene era crisis. The pandemic officially is over, but the lessons still to be learned and drawn for our future. These are bitter lessons of the COVID. We know that though this pandemic might have been officially over, but the next one is in the waiting. We don't know when, we don't know how, and we don't know from what kind of virus or bacteria it would come with. But we have to understand our shortcomings. We have to understand our mistakes, what we did in the process of handling the pandemics, and we have to make the best decisions to be better prepared. Once again, the question is not whether or not we are going to have a next danger from pandemic, but the question is when it comes and whether or not we are prepared or not. So I'm grateful for the two ambassadors of Morocco and Israel for leading the member states' preparations and negotiations for the political declarations that will be adopted at the highest level during the September high-level week. Ladies and gentlemen, for these three major human-centered processes of health, we need everybody on board. We need all stakeholders aboard. We need commitment of the global community tackling health-related crises, but we also need to know that it is not purely a health issue. It's an issue of policy making, an issue of financing, issue of scientific progress, issue of technological advancement, and issue of how we build trust among ourselves and how to rebuild our networks of cooperation. And before wrapping up, I want to thank the WHO's support in organizing this week hearings and in general providing assistance for the negotiating processes in the General Assembly. Thank you very much.
I was wondering how you can prepare for the next epidemic if you don't know where it's going to happen or how it will happen, or, you know, it's a complete mystery. Thanks.
I wish we knew exactly what kind of virus or bacteria would come. You might have heard about the research which is called DAMA protocol. DAMA protocol is trying to identify those mostly viruses that have most potential of making the big jump to the human body. We know that there are about 8 strains on the watch list now, but the number of the potential bugs are much, much higher. But this is not what we can decide here in the General Assembly. It is a job for researchers, for scientists. Our job is to draw lessons learned from our own mistakes, what we have done in the last couple of years, how we organize ourselves in terms of medical supplies, how we mobilized our finances for fighting the pandemic, how we used the scientific knowledge for political decision making, and how we shown solidarity during the fight against the pandemic. If we draw our lessons learned from that, we do our part of the work, and we are asking the scientists, the scientific community, to come for our help, to help us with the highest possible probability when and what kind of strains, viruses, and bacteria could come the next. It is still an unknown, but we are focusing on them, on the potential sources of danger.
Thank you for your leadership on this throughout the day and yesterday as well on TV. A lot around multi-sectoral collaboration came up in the room today, and cross-collaboration and coordination between governments. You also mentioned Anthropocene, and we know that climate change drives emerging pandemics. So how do you see climate conversations and health conversations convening at a very high level through this? And can there be better synergies created between these two sectors in these forums so that that can be spilled over into national and regional conversations and in academia as well? So.
Thank you much. I couldn't agree more with you. Climate change itself does not cause pandemic. But climate change creates conditions that are very conducive for pandemics. It amplifies some of the factors, including those that might be favorable for the spreading of new type of bacteria or viruses. It is not by surprise that during the high-level week, we are going to have a climate ambition summit, and on the same day, we are going to have just a few hours, with a few hours difference, the health-related summit. There are quite a few areas which have a great impact on our preparedness for the next pandemic, but obviously how we treat, how we try to prevent, or how we get accommodated to the next wave of global warming will have a great impact of how we are going to weather the pandemics of the near future. But it's not only climate change that has an impact on the potential of the new pandemics. The closer we get to nature, the habitats which were untouched for thousands of years by humanity, the more will be the immediate physical contacts between those carriers of the diseases and human beings. That's what we see now on a yearly basis with the outbreak of very rare diseases coming from those areas where the natural habitat and the human habitat are meeting. Unfortunately, we noticed that there is a new outbreak of Marburg disease in Africa for the similar reason.
Perhaps one more question, because I know the President and ambassadors have very limited time.
Arnold Lewis from IANS. Right now, TB is probably the biggest killer since we passed the COVID pandemic. Are you trying to get laboratories, especially in the private sector, involved in developing a vaccine for it, which has been a massive failure so far?
The private sector is here with us in the multi-stakeholder discussions. Yes, without them, we cannot solve this problem. Governments alone, NGOs alone, cannot prevent the next pandemic. We need the private sector, and we need the science community. We need new solutions, and we need new methods of implementing those solutions. There were rightly many critical words to the big pharma during the pandemic. But we have to acknowledge that without the scientific breakthrough which was achieved at the beginning of this pandemic, we would not have been able to prevent much more lives to be lost. So my message to the private sector: yes, you have a role, you have your own responsibility. Please come work with us. We are counting on you, and your words are also counting in our final decisions. Thank you. Thank you much indeed. And let me just call to your kind attention that in the course of the further negotiations on all three tracks, the ambassadors behind me, whom once again I would like to thank for their wonderful work, would be at your disposal for your convenience to be addressed, to ask questions, or give you a background information on the course of the negotiations. Thank you very much, and I wish you a nice day.